You know, back pain is one of the most common medical complaints, but it's a lot more complicated than you might think. Dr. Yusupov is here, a neurosurgeon with the Arizona Brain and Spine Center and John C. Lincoln, and he's going to help us out today. Thanks so much for coming on.
Thank you for having me.
Yeah, let's start off with just talking about back pain in general and what we're dealing with here when we talk about back pain.
Absolutely. Well, spine is an interesting component of our skeletal system. It's got three basic reasons or structural issues. There is a structural support for our skeleton, there's protection of the nervous tissue, and there's also flexibility, so we can turn every which way and navigate. The structural integrity is provided by the vertebral bodies, which are made of bone. Cushions are made of ligaments and soft tissue, so that provides some flexibility. And the opening inside is what provides the pathway for nervous tissue, so it protects it within the bony components.
Yeah, these segments make a big difference in how back pain affects us.
Absolutely. And since it's a live structure, there's all kinds of vessels and nerves endings that are innervating the structure. Any one of these components could cause back pain.
All right, and let's talk about the causes of back pain. What's the most common cause?
Obviously, the most common cause is musculoskeletal strain. It's a weekend athlete who's leading a sedentary life most of the time, but overexerts himself or herself during the weekend and sprains the back. Majority of those conditions are not life-threatening, of course, and not related to significant trauma or tissue damage.
All right. What are some of the other causes that, may cause some back pain that we talked about?
Well, degenerative condition is common, and that's where the discs and other components wear out due to wear and tear and may lead to pain. But also trauma is very important, and that is something of more of an acute nature and needs immediate sort of intervention or at least a medical assessment.
Now, what about dangerous back problems that may not cause a lot of pain? There's some out there, right?
Absolutely, and that's probably the most concerning of all back problems. It occurs in the neck, and it's due to wearing out and tear within the disc and herniation or protrusion of the disc to the back of the spinal canal where the spinal cord comes through. The reason why it's dangerous and devastating is because of lack of pain sensation in the spinal cord. So people don't notice pain sensation, but it leads to very subtle at first neurological damage, such as fine motor control, coordination problems, difficulties with balance, and bowel and bladder function. Most people discount that to aging and such processes because of its very slow progression. But the reason why it's so devastating is because the damage that's done cannot be undone by surgery. So surgery is meant to alleviate and stop the progression, but not so much to cure the problem or restore the function.
All right, and what about if you're having back pain? What can be done to relieve that?
Well, most patients would get better on their own without medical attention. Some would require some initial support, and that's usually patients presenting to a primary care physician for pain relief and physical therapy. Initially, conservative management means rest, and it doesn't mean bed rest, it just means take it easy. And pain medications could be in the form of narcotic if severe, or just plain old Motrin or Tylenol. Those who don't get better initially within a few weeks should seek physical therapy, and that is the best initial treatment option. 4 to 6 weeks of physical therapy should usually be sufficient to improve function significantly and restore the functionality to the baseline. If physical therapy has not improved patient's condition, then surgical evaluation is warranted.
All right, so you kind of take it through those steps. Many moms have back pain too, and it kind of goes with what we were saying as far as just if you have any more problems, kind of take it to the next step. Where can people find more information on this?
Well, obviously, we have a lot of information on the John C. Lincoln website, and I would definitely encourage everybody to check that out. But a friend of mine recently told me that Phoenix has the most spas per capita. And I would encourage everyone to take that opportunity and take advantage of the city's opportunities and send their moms to spas.
I like that. So a spa for Mother's Day, it's for our health, everybody. All right. Thanks so much, doctor. Good to meet you and see you today. For more information, jcl.com/neurosciences or azbsc.com. All right.